Steve Adubato in Philadelphia. This is a really important summit. Summit put together by the folks at Virtua and CHOP, the Children's Hospital of Philadelphia, all about collaborations in the area of healthcare. And we are pleased to be joined once again. We talked to her last time, Stephanie Fendrick, who is Senior Vice President of Strategic Partnerships and Service Line Strategy at Virtua. Stephanie, collaborations, let's give a sense of what we mean by that. First of all, the Virtua and CHOP collaboration is a big deal. But what kind of collaborations are we really talking about, and what does it mean to consumers of healthcare?
Sure. So when we talk about partnerships, Virtua wants to be known as the place for anyone in our community to come to us for their healthcare needs. That doesn't mean that every single one of their needs that Virtua can meet, and that's where partnerships and collaborations come in. So we first look at partnerships in terms of what services can we bring into our community that maybe we have a gap in today so that it's convenient, accessible for members in our community to get that care. And then there's certain types of more tertiary, quaternary type care.
What does that mean, tertiary, quaternary? I can't even say quaternary. So go ahead, describe that.
Sure. It's more advanced care. You usually need multiple specialists. Fortunately, there's a smaller volume of those types of cases. So in order to gain a real competency or skill set and be able to take care of those patients, we look to our partners to work together on things like quality, ease of access, working to get the patients to get to our partners, for instance, Penn Medicine for cancer and neurosciences, and certainly the Children's Hospital of Philadelphia for pediatrics. Help that family and patient for those advanced needs, and then have that patient come back to the community so that we can continue to follow them for their routine needs.
So is it basically saying that a hospital should not try to say it can do everything for everyone, because it actually can't be, it isn't the best option to do everything for everyone?
Well, I think you have to know what your strengths are and work off your strengths. And I think it's important to know where you might have some gaps, and can you fill those gaps within your community, or is it
Which is a strength to be able to know what you're really good at.
Absolutely. If it's something that just the volume's too low or the investment to have that kind of expertise is too high, then it's important to consider partnerships as an option to meet those needs for the community.
So it's interesting, strategic partnerships. You have them with CHOP, because we were talking with the CEO of CHOP, and she was actually talking about that. She was saying, you know, yes, we do have this worldwide brand, and they're the oldest children's hospital in the country. I didn't realize that. She said, but certain procedures, certain medical procedures, they shouldn't be done here, and that's why they collaborate and send folks to other hospitals like yours.
Absolutely. And that's really the beauty of our relationship with the Children's Hospital of Philadelphia is we've really been able to talk about the right level of care at the right place, at the right time, at the right cost. And there's a place for Virtua in that description, and there's a place for CHOP in that description as well.
Okay, so let me play devil's advocate. Competition in the marketplace, right? So everyone is competing to stay in business. Everyone's competing to maximize, I don't want to say it's profit because they're nonprofits, okay? But at the same time, to do well. How the heck do you collaborate in a region and in an area when you're competing? Isn't that hard to do?
Well, I think, again, it's going back to what each organization's strengths are. While there might be some overlap, for the most part, I mean, if you hear Madeline talk about the Children's Hospital of Philadelphia, the CEO, I would say, 95% of their beds are more ICU level beds. That's not the space that Virtua is in, and that's where you can start to really play off each other's strengths. The same with Penn. We have a partnership with Penn Medicine. We announced it about 2 weeks ago, and the types of patients that they take care of are much sicker patients, more complicated patients. Again, that's not the space where Virtua is going to be. Our opportunity with Penn is they've invested a lot in cancer research, in research for neurosciences. How do we benefit from those investments that they've made and bring that into our community for our patients in South Jersey?
It's interesting. You have to establish those relationships. You have to build those partnerships, because you just all of a sudden can't send someone to Penn or send someone to CHOP. You're working on those relationships all the time, aren't you?
It's like any other relationship. It's one that, you find where you are aligned. You start to work towards that alignment. You find areas where there might be some disagreement, and you work through them. You nurture the relationship. You build trust. And over the course of time, you get to know each other's cultures more, and you can really anticipate each other's reactions and work together more effectively.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Health Republic Insurance of New Jersey, the New Jersey Education Association, Wells Fargo, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, MD Advantage Insurance Company of New Jersey, and by NJ Best. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.